You're watching TV9 Digital. I am Adarsh Pachedu. Right here, I've got the results of the third National Sero Survey. This survey was conducted between December 17th, 2020 and January 8th, 2021. The big picture is that over one-fifth of the country's population, or 21.5%, was at some point infected by the coronavirus by mid-December 2020. Simply put, a sero survey involves testing of blood serum of a group of individuals in a given population to trace the presence of antibodies against the infection. Now, if you have antibodies, it simply means you were infected at some point and have recovered, all thanks to those antibodies. So what else has the sero survey got for us? The data is on your screen. 31.7% of those staying in urban slums have been infected by mid-December, 26.2% in urban non-slum, and the lowest seroprevalence of 19.1% among the rural masses. Now, what may surprise you is that more females in the country have been exposed to the virus than males. The figures stand at 22.7% versus 20.3%. Now, if you look at the age-wise split up, those in the age group of 10 to 17 years seem to be at most risk, with a seroprevalence at 25.3%. Those in the age group of 18 to 44 seem to be least affected at 19.9%. Talking about seroprevalence among healthcare workers, the overall figure stands at 25.7%, which means over one-fourth of the healthcare workers were at some point infected by coronavirus. Now, among the healthcare workers, doctors and nurses are at a higher risk with seroprevalence at 26.6%. Well, let us now address the elephant in the room. How close are we to herd immunity when we say 21.5% of the overall population was at some point infected by coronavirus? In fact, I had a word with Dr Sitesh Roy, allergist and clinical immunologist from Mumbai, and here is what he had to say.
So herd immunity is reached when a critical mass of people are immune to the virus, which means they've been either infected or vaccinated and hence would not get the infection if they were exposed to the virus. For herd immunity to occur, we normally say that 2 out of 3 people, which would be 66.66% people, should be immune, and we are at 21.5%. Now with SARS-CoV-2, because it has a R0 or a spread from one person to 2 or 3 people, we need a higher number of seroprevalence, which would be closer to 75 or 80% of the people to have protective antibodies either through naturally acquired infection or through vaccination, and hence we are nowhere close to achieving herd immunity yet on this seroprevalence survey.
So, what are the big takeaways from the third National Sero Survey? For one, a large population still remains vulnerable to COVID-19. Prevention is key, and so is taking your shot of vaccine when it's your turn. And at the same time, we cannot afford to be complacent. Mask, social distancing, and hand hygiene are the biggest weapons we have. If you've liked the content that I've presented, make sure you like and share this video. Do not forget to subscribe to TV9 News on YouTube, Facebook, Instagram, and Twitter. Until next time.